Ascension Saint Thomas Midtown now says it has taken steps to prevent another medication mix-up in its pharmacy. This comes, of course, after 4 patients had the wrong medications injected into their spines, causing serious health complications.
At least one woman was left paralyzed, according to her family. Late last week, the hospital announced changes in protocol in its pharmacy, along with additional new safeguards.
But as investigative reporter Jennifer Krause discovered, there are questions about why these measures were not already in place.
It's sad that something like this would happen in today's healthcare.
Dr. Stephen Eckel, like so many, was stunned to hear how 4 patients at Ascension Saint Thomas Midtown received the wrong medication when they went in for routine joint replacement surgeries August 14th. Late last Friday, the hospital acknowledged that a mix-up in the pharmacy led to 4 patients being injected not with mepivacaine, a standard anesthetic, but potassium phosphate, which if given in an undiluted form can cause devastating health complications, including death. That's potassium on the left and mepivacaine on the right. And while the 2 drugs can come in different types of packaging, and we do not know if these are the types of vials that were confused, these examples do show how similar the 2 medications can appear.
I mean, I think we have come to recognize in healthcare, especially in pharmacy, that look-alike, sound-alike medications are prone to cause issues and problems.
But Dr. Eckel, who teaches at the University of North Carolina's Eshelman School of Pharmacy and is also a longtime hospital pharmacy administrator, says that's why multiple layers of safeguards are so important, especially when dealing with a potentially high-risk or high-alert medication like potassium. Safeguards like keeping these drugs in a separate area away from the other medications, which forces the pharmacy employee to be more deliberate when handling them.
We want to make sure that when they pause and using them, that they think and say, okay, I need to make sure this is being used correctly.
Also highly recommended, barcoding technology that the employee uses to scan both the drug and the hospital label and gives an alert if the 2 do not match.
Would you say most hospitals already have these in place?
I know it's what we advocate for and what we teach and educate individuals, organizations to be doing.
But those safety protocols apparently were not in place, or at least being followed at the hospital when the medication mistake happened. Because these same safeguards are exactly what Ascension Saint Thomas announced it was implementing in its pharmacy late last Friday, a week after the mix-up.
And so it sounds like these sorts of steps should already have been in place.
Those are steps that we should be using in the care of patients, correct?
Nothing, he says, will change what happened here, but hopefully the changes being made will make a difference.
The bottom line is we want to make sure that this does not happen again in this hospital or any other hospital. And so this should be a wake-up call for every hospital to go back and evaluate, do they have the best practices going forward?
Jennifer Krause, News Channel 5 investigates.
Ascension Saint Thomas also says that all spinal medicine must now be double-checked by a second trained pharmacist. In addition, the hospital says that it has brought in independent third-party experts to review and validate these new safety measures.